based at Bournemouth University, and I'm an academic psychologist, so not the kind who treats people, but the kind that does research. I did my PhD on sort of the brain science of autism, and then nowadays I specialise more in the issues that affect autistic people in their day-to-day lives. You know, what are the things that make us happy or unhappy, the challenges we face. So I'm especially interested in mental health, self-injury, suicide, late diagnosis, issues affecting autistic girls and women and people of minority genders, and also reproductive transitions. So this is me on paper, my professional bio. And on paper it looks fairly shiny. But as I was saying, I've had a lot of other labels and identities during my lifetime. When I was in primary school, my teachers told my mum there wasn't any point teaching me maths because I would never be able to go around a shop myself. I didn't have a diagnosis at the time, but you know, that was it, kind of case closed. And I was the kind of child who really struggled, very confused, very, very anxious. The kind of child that other children didn't want to sit next to or stand next to in line. Didn't have friends, really. People didn't want to be seen with me or be my friend. The kind of person who always seemed to struggle from one thing to another, and picking up all kinds of labels, like annoying, and disgusting, weird, and all these happy things. Some of them you give yourself. And a lot of these things, these labels, these words that are said to you, and the things that happen to you, echo throughout your life. So at very difficult times, these kinds of things would sort of echo in my head. And one thing that was said to me once was that it was always one thing after another with me, which was true. It was always one mental health problem after another. But it all made sense, finally, when I got my autism diagnosis aged 28. Really embarrassingly, I had done a PhD in autism at that point. I had done a postdoc in autism. I had trained to use autism diagnostic instruments so I could diagnose people. And all of that I did while being blatantly autistic. And it was only when I was in my second postdoc job as a scientist, and my mum said, you know, all those psychologists we took you to as a child, do you know the working diagnosis was actually autism? They said you probably wouldn't get the diagnosis because, you know, girls are often missed. And that was exactly what happened. So I'd never known that autism was the working diagnosis, but as soon as I had that knowledge, I was already studying the different profile of autism in girls and women, and suddenly all the pieces fit. So I got my diagnosis, and it really changed my life. That sounds a bit dramatic, but it's true. And so it's lovely here today to see all the resources at the back showing such positive sides of what autistic people can do and achieve, because we have so fantastic talents and qualities. And I can certainly say that my autism makes me a better scientist, makes me really interested in the details and, you know, digging through, getting down a rabbit hole, being very methodical and logical. So my autism definitely serves me in that regard. But I don't want to kind of give a false view, because I think with a lot of us, when you see the person on the surface, it's a bit like the swan on the surface of the water with the legs kind of frantically paddling underneath, and certainly
For me, I get a huge deal of practical and emotional support from my family, which is why I'm here today. So this is me, and I'd like to just give you an overview of what I'm going to talk about today. So I've been asked to talk about mental health in autistic people, and you can't really do that without talking about a few related areas. So I'm also going to touch on self-harm, on suicide and burnout. I want to talk a little bit about some of the factors that explain why autistic people are at higher risk of these outcomes. I want to give you a few of the signs that might help you to recognize if someone is in crisis. And then I want to finish with a few thoughts about what we can take from this around how we can improve mental health and how we can support people when they're struggling. So really, really importantly, I just want to really reiterate what was said earlier, just around please do take care of yourselves, because these are really sensitive topics to cover. So please feel absolutely free to step out, take a breath. So let me launch into it. You might know already that unfortunately research tells us that autistic people have higher rates of nearly all mental illnesses. So if you look at the lifetime prevalence of mental illnesses in autistic people, basically that means how many people will experience this mental health condition at any one point in their lives. Many of us will experience them many times in our life. So 42% of us will experience anxiety disorders at least at one time in our life. 37% of us will experience depression at some point in our lifetimes. 9.4% of us will experience a psychotic disorder, such as something on the schizophrenia spectrum. 9% of us will experience OCD, obsessive compulsive disorder. 7.5% of us will experience bipolar disorders. And 5% of us will experience eating disorders, though many more of us will experience other forms of difficult eating, or what clinicians call disordered eating. So these are all statistics that are far greater than you would see in the general population. And it's really important to say that it's very hard to get accurate estimations of some of these things, in part because sometimes they're quite secretive. People may not want to come forward, but also because it might be quite hard to diagnose mental health conditions in autistic people because they look a bit different. So for instance, when you think about depression, one of the most common signs of depression in non-autistic people is crying, is saying things like, I feel very sad, I feel low, I feel hopeless. Autistic people might do those things, but they're not the most common features. So in autistic people, for instance, the most common feature is actually something called anhedonia. So it's a loss of pleasure and interest in everything you typically enjoy. So depression might look a bit different, and at the same time, aspects of our autism might be wrongly interpreted by the professionals and the people around us. So some of us don't tend to show a lot of emotion in our voices. We might have a face that, we don't show a lot of emotion. And those things could potentially be interpreted as signs of depression, for instance, by doctors who don't know us well. Anxiety disorders, likewise, they don't look quite the same. They don't fit neatly into the categorical boxes that are used to diagnose anxiety disorders. And some mental health conditions which are characterized by kind of rigidity, by needing to do things in a certain way, at a certain time. So if you think about obsessive compulsive disorder, and also some eating disorders, people can be very ritualistic. And autistic people, we of course also like to have our routines. We like things to be done in the same way. So if someone doesn't know us very well, it can be quite hard to tell what of this is driven by a mental illness and what of this is just normal autistic, doesn't need any interference. So it's very tricky. And sometimes if someone is experiencing a mental illness, it can mean that their autism isn't picked up. So if we look at the autistic population as a whole, we can see that certain individuals seem to be at higher risk of mental health problems, but also self-injury and suicidality. So having co-occurring ADHD, so being an ADHDer, seems to increase your risk of anxiety and depression, and also it increases your risk of suicide. So this kind of makes sense in the way that ADHDers are really poorly understood and really poorly catered for. They have slightly different needs than autistic people and ADHDers alone, but society doesn't really understand that or accommodate it. So it's really hard to be an ADHDer. What's quite interesting is that when it comes to mental illness, we see slightly higher rates in people without learning disabilities or intellectual disabilities, which is the term often used in the US and in scientific literature. So what we tend to see is a bit of a pattern where in people with learning disabilities, we tend to see more neurological conditions. So we see epilepsy, for instance. In people without learning disabilities, we tend to see more mental health conditions. Really important to say, you also see neurological stuff in people without learning disabilities, and you also see mental illness in people with learning disabilities, but it's kind of like the weighting is slightly different. So learning disability, slightly more neurological, other developmental conditions, and without learning disability, slightly more mental health conditions. And what you see in autistic people kind of ties in with this. Often you see when people have higher IQs, they tend to have poorer mental health and possibly even higher suicide rates. And that's really unusual. It's important to say that. So in the general population, what you tend to see is that when people have higher levels of education and higher IQs, they often have slightly lower levels of mental illness and suicide. Not so in autistic people. So greater IQ, kind of greater academic qualifications, they don't lower your risk of these things. In fact, they might actually increase it. And this kind of ties into what we know about late diagnosis and camouflaging or masking. So if you have quite strong language skills and cognitive abilities, it can be easier, it's the wrong word, but some people are able to mask their autism quite well, meaning that they don't get diagnosed and they don't get support. Hence, you might see that relationship where if you have a higher IQ and so forth and no learning disability and you're more able to mask, you might actually have higher risk. And interestingly, we also see differences by gender. So there's a really startling statistic that almost 1 in 3 autistic girls and women are actually hospitalized for a mental illness before the age of 25. That is shocking. So really, really important to say, autistic people of all sexes and genders, unfortunately, are at higher risk of mental illness. But autistic women, girls, and gender minorities, and for instance, transgender people, they seem to have higher risk of all. So if we look at the sort of trajectory of mental health conditions across the lifespan for autistic people, we see something of a bit of a consistent pattern. So what we tend to see is that anxiety disorders are the first to develop, and they kind of start developing in childhood. We then see Other illnesses like depression, psychosis, if that's an issue in the picture, they come in a little bit later, kind of late childhood, early adolescence. Psychosis tends to be a bit later, maybe kind of later adolescence. And you might see suicidal thoughts also coming into the picture around that time in adolescent years. But what we see in autistic people, again, looks a little bit different to what we see in the general population. So in the general population, we tend to see this spike in mental illness and spike in suicidality in the teenage years, and then it kind of flattens out again. In autistic people, it tends to spike in the teenage years, as you can see, but then it continues on high throughout our lifetimes. And what we tend to find is that autistic people sort of accumulate diagnoses. So rather than flattening out, we kind of just keep on collecting them, as I can certainly attest to. And it really gives me, I confess, some degree of pleasure to say that I was a really strange neurotypical, but as an autistic person, I'm so boring. I'm so textbook. So I fulfill all the stereotypes. Anxiety, which kind of showed up in my early childhood. And then, unfortunately, that was followed by depression, self-harm and suicidality that really kind of started 12, 13. And around the same time, disordered eating really kicked in, though I didn't receive a formal diagnosis of an eating disorder until I was in my 20s. And I would say that that sort of peak period during your adolescence, I would venture a guess, just from personal experience, how it was for me, that part of that might be your growing awareness of your difference. So for me, the depression really kicked in around about the time when although I was very confused as a child, I was very, I didn't have a lot of self-awareness. I really didn't understand what was going on with me or with people around me. So although I knew I was different, I didn't feel that gulf of difference, which as I went into my teenage years, only grew and grew, and I was aware of it. By my teenage years, I was really aware of it. This kind of fits with what we know about autistic girls and women, because scientists have put forward this idea called the adolescent emergence hypothesis. Basically, what it means is that whereas with autistic boys, they tend to look quite different from non-autistic boys all through their childhoods. Autistic girls look much more similar to non-autistic girls in their childhood years, so they don't stand out as much. But what you see with autistic girls is you see that increasing difference as they age. Whereas for boys, there's always the difference. It doesn't increase as they age. So that feels kind of relevant for me, because certainly that gulf of difference just grew with every year, really. So you can see this in trends that we see across big populations of autistic people. That, as I mentioned, mental health conditions seem to peak in adolescence, but they seem to peak more broadly in relation to reproductive transitions. So puberty. What you can see in the image there, I'll kind of unpack it a bit because you might not be able to see it, is you can see a sort of flat blue line that's kind of dotted, which is cisgender males, and you can see a sharper red line, which is cisgender females for autistic people. And so what you can see is basically from childhood to adolescence, mental illness climbs much more sharply in autistic girls. For boys, it's high when they start and it's high when they finish, but it's quite a flat line, not a lot of change. Whereas for girls, they start lower in anxiety and depression, but they end up actually higher than the boys. And so puberty, of course, there's a lot going on, isn't there? Lots of hormones, lots of life changes. And we know that hormonal transitions like puberty and also menopause is one we've identified. There are times when your brain is undergoing massive reorganization in function and structure, and your whole world is really changing. So they're really peak times for people to struggle. And we really have seen that in relation to puberty and menopause. So I want to say a little bit about a few related issues. I don't think you can really talk about mental health in autistic people without talking about self-injury and suicide, as much as it might be difficult to do so. So you might ask, how common are these issues? We don't totally know, because as I said, they're often things that people don't really talk about. They are still stigmatized. So self-injury is a bit of a hard one to kind of estimate how common it is. There's one statistic that 42% of autistic people will engage in self-injury at some point in their lifetime. But this isn't an easy statistic to understand, because there's very different forms of self-injury in autistic people. For some people, typically when they have learning disabilities, self-injury might be slightly more like a stim, slightly more like a repetitive behavior. It might go along with other kind of stims or repetitive behaviors like rocking or flapping, whereas you might see quite a different form of self-injury in autistic people who engage in it in secret, who maybe use implements, for instance, to cut themselves. It looks very different. Whereas one form of self-injury might be done out in the open and the person doesn't try to hide it, the other form of self-injury is typically secretive. There's some degree of planning and delayed gratification. So for instance, if someone uses implements, they might not, they can't immediately do that. And so we tend to think of these forms of self-injury as slightly different. And that form that involves implements, such as cutting, such as, that more secretive kind, actually looks very similar to what we see in the general population and we call NSSI, non-suicidal self-injury. So we don't know how common this is in autistic people, but we know it is much more common than you see in the general population. So in the general population, NSSI, like mental health, it kind of peaks in the teenage years, but then it kind of flattens out. In autistic people, we tend to see, again, peaks in the teenage years, but then stays high. And I can certainly talk more about NSSI and the sort of functions it plays later on, if that's helpful for people. So, non-suicidal self-injury is one thing, but we also see very high rates of suicide in autistic people. And one thing I want to say really clearly here is that there is massive gaps in our science. I think it's super important to say that because I don't want to scare anyone here today. I want to tell you about this, but I don't want to give you the impression that everyone's going to experience this. So some of our studies suggest that suicidality is very common, and we believe it is certainly more common than you see in the general population. So one statistic is that perhaps 1 in 3 autistic people will think about suicide at some time in their lifetime, and 1 in 4 or 5 will actually attempt suicide. If we compare that with the general population, 1 in 10 will experience suicide ideation, so they'll think about suicide, and perhaps 1 in 25 will actually, no, I think it's far less. Can't remember the exact statistic. But you can see the statistics are much higher in autistic people. But we don't know for sure how common this is, just because our science, we tend to attract people who this is an issue for. So it's hard to know exactly how common it is. But what we do know, as I mentioned, is that when people do experience suicidal thoughts, those tend to come about at quite a young age. So we recently did a study with almost 1,400 autistic adults, and we asked them how old they were when they first experienced thoughts of suicide. So the average age that people reported was around 16 years old. But really interestingly, we found that there was a standard deviation of around 9 years. Let me give you to that in non-science speak. So on average, people experienced, the average age of suicide, first experiencing suicidal thoughts was 16, but the standard deviation is basically how much do people differ from that? What's the average amount that people differ? And so a standard deviation of 9 means that most people fall 9 years on either side of that average point. And if you unpack that, 9 years younger than 16, it suddenly becomes a lot more shocking. So some people would experience suicide ideation for the first time, in the years after 16, but you can see that it begins a lot younger in autistic people, as I already said. And as I mentioned, certain characteristics seem to be associated with more risk, like being ADHD, having a higher IQ, being a woman or a gender minority, and things that normally protect people in the general population don't really seem to protect autistic people in the same way. So often people who are employed in the general population are at lower risk. Autistic people who are employed are not at lower risk, because of course being employed brings its own challenges. So I also want to talk about another correlate or another really important facet of mental health and also suicide in autistic people, and that's burnout. So there's been a lot of debate about burnout. What is it? Is it different to the burnout that you see in the general population? And the kind of definitions that people come up with and give us is that it's a case where a person experiences severe, disabling mental, physical, and emotional exhaustion. It's not a mental illness, but it's such a terrible state to be in that it can interact with and worsen mental illnesses and also physical ones. And so masking has been linked with burnout exhaustion. People are often, exhausted by masking, essentially. And then burnout has been linked with suicide. So again, we don't know how common it is. It's really a new area of study. But one research study suggested that maybe 70% of autistic people had experienced an episode of autistic burnout at one point in their lifetimes. And around 46% said they'd experienced more than one episode of burnout. This is, I think, more worrying because it's not recognized as a serious health condition by, for instance, the medical profession. So you're really hit and miss about whether your doctor will know anything about autistic burnout. And that really puts us at threat when we experience it. So let me go back to some of the causal factors that give rise to mental illness in autistic people. I've kind of touched on a few of them, so you might have got a bit of a taster so far. If we take mental illness as the kind of gateway to self-harm and to suicide, as it very often is, we can try and understand the causes of all three, and also burnout, at the same time. So when I talk about the factors that give rise to mental illness, they also apply to these other things. So first off, genetics. There is some evidence that the genes that make us autistic might also be associated with vulnerability to depression, to anxiety, to other kinds of mental health conditions. So there may be some genetic shared element where if we're autistic, we also have those genes that make us more vulnerable to all those other things. However, unpicking the relationship between genes and how you turn out is really hard. So if you have the genes for autism and you later develop depression, Is that because you have the genes for depression? Are they part of the autism genes? Or is it because of the things that happen to you as an autistic person? So this is really what we see in terms of the environment having a massive, massive contribution to mental illness in autistic people. We know that autistic people are a much higher risk of trauma throughout their lifetimes. So we experience higher rates of adverse childhood events, such as being abused, but we also see this continues into adult life. So we know that autistic people are much more likely to be victimized, to be excluded, to experience abuse in relationships, such as intimate partner abuse, to be victimized at work. It kind of carries on through our lifetimes. And what we know about stress and trauma is that they change the nervous system. The nervous system and the brain is very responsive to stress and trauma. So if you experience a lot of it, it actually kind of sensitizes your system, puts you on red alert, you might say. It's kind of evolutionary because you've experienced all these threats and then your brain spots them more quickly so that you can run away. Only, of course, in our environments, we can't run away. So we're very sensitive to stress and we get triggered more easily if we've experienced a lot of it, but we can't escape those stressful environments. So we live in a world that's not really made for us. So we have environments that are really inaccessible. So there's a lot of kind of daily stress in living in that world that's not really made for you. All the sensory stuff going on, the school environment, the work environment. You might find that you don't get a lot of support. This is a really common thing. We all know it can be really hard to get mental health and also any support for neurodivergent things in this country. And we tend to see people also really struggle with social isolation. What's really important is that humans are very social animals, and our brains are geared towards being very social. So we actually get massively triggered by social threats, what we call. So these are things like being isolated, by being rejected, by being invalidated, which are all kind of constant experiences for autistic people that trigger our stress systems. And really problematically, what we also find for autistic people is that a lot of this invalidation and this victimization actually comes from people who are in positions of authority or responsibility for us. And that is an additional level of difficulty, really, if this kind of trauma is being perpetrated by people you trust and who should be there to help you. So it kind of ties in with this, as you might expect, that being late diagnosed is a really strong factor in poor mental health. So if you are late diagnosed or undiagnosed, it's really hard to get support. You don't really get any recognition for the things you struggle with. So that kind of explains why late diagnosis is so associated with bad mental health. So I want to talk a little bit about some of the features of being autistic which might actually sort of worsen the impacts of stress and trauma. So we know that autistic people experience a lot more stressful things in their lives, a lot more traumatic things, but certain aspects of being autistic might actually kind of compound those and worsen them. So for instance, intolerance of uncertainty and struggling with change. Many of us find it really hard when things are uncertain. I know I find it really paralyzing, so difficult to not know what's going to happen. And likewise, if you struggle with change. Part of this is around executive function. I tell you, when I'm driving and there's a road closure, this is just like, oh. But in my day-to-day life, when there are changes, it's really hard to deal with. It's very hard to generate a new plan right there and then. As I mentioned, we tend to be very isolated, and that means that very often that when we're stressed or when we're triggered or traumatized, we don't have someone there to kind of vent with, to kind of decompress with. We're sort of alone with those things, and they just go round and round in our brains. That's partly related into that thing I mentioned about executive function. So autistic people tend to have a profile that scientists call having kind of cognitive rigidity. What that means is we can't move on from things very easily. Our brains are sort of sticky. So having a sticky brain, or my mum calls it railway line thinking. It's like your brain is on a track and it's really hard to get off that track. You can't just switch off when things change. And that means that when things happen to us, they kind of go round and round and round in our heads and we can't switch away from them. So another thing that kind of affects and worsens our ability to cope with stress is something called alexithymia. You may have heard of it, you may not. It's a really common co-occurring, it's either a condition or a personality trait, we're not sure, but it's really common in autistic people and it's not diagnosed. What it is basically a difficulty identifying and describing your emotions. So people with alexithymia might have, they can kind of feel like a massive bad, I don't feel good. I know that I don't feel good, but I don't quite know how I feel. Is it sadness? Is it anger? Is it fear? Why am I feeling this? Where has this feeling come from? And often with autistic people, we're actually far from the myth of being unempathetic. We actually soak up the emotions of other people. We're kind of like emotional sponges. And if you have alexithymia, that's really difficult because there's all this emotion. There's, I feel really nasty, but I don't know is it me? Is it coming from me? Is it coming from you? What is it? So that's really hard to live with. And living with alexithymia is kind of like going through life with blinkers on. Because people without alexithymia, when they are aware of their emotions, they can kind of look after themselves. So I'm getting this feeling that, I'm uncomfortable. So I might leave that environment. I might take steps to make myself feel better. Whereas with alexithymia, what tends to happen is your stress levels, your emotion levels get higher and higher and higher. And you might only recognize them when they're up here. And at that point, there's no going back. And that might be where you hit a meltdown. Whereas other people, they can kind of, they're very aware of their emotional thermometer. So they get out there when the emotions are around there. So it means that we really struggle to regulate ourselves when we experience anxiety or difficult emotions. And it's a huge factor in our mental illness. I mentioned masking. So we often engage in masking to protect ourselves from victimization, from being excluded. But as I mentioned, it's exhausting and it's really strongly linked with mental illness, with burnout and suicide. So we know that people who mask more are at higher risk of these things. One thing I find really interesting as well, really relevant to me in my job, is that switchers are also at high risk. Basically, what that means is if you constantly switch in and out of masking mode, it seems to be just as bad as if you spend the whole time in masking mode. So you can think of masking as almost like a chronic stressor, something stressful, in that it's putting a strain on your body and your mind and causing you harm. We also know that autistic people very often feel like we don't belong. We often feel like a burden, often because there isn't sufficient support out there, and hence we kind of internalize it on ourselves. And that is something that is a really, really big factor in mental health struggles. And I wanted to show you a conceptual or theoretical model of burnout, which kind of shows the same thing. So you've got all this life stress on the left-hand side, so all this load of stress that's being put on you. And at the right-hand side, you've got lack of support. But you've also got more stress coming in there. So when you're seeking support, there's actually more stress coming in because you're being dismissed, you're being invalidated, your boundaries might be being violated. So you're not getting any help to cope with the stress, you're actually just getting more stress. And eventually that leads to people actually reaching burnout. So let me say a few words about what crisis can look like in autistic people, because some of you here might be supporting an autistic person, and so this could be quite useful information. Really importantly to say, crisis and emotions look different in autistic people. So very often an autistic person, so for instance, if someone is experiencing suicidal thoughts, they might talk about them in a really calm, really logical, really quiet, unemotional way. Very often our inner state doesn't match what the observer can see on our face and in our voices. So it means that it can be really easy for non-autistic people and doctors to overlook what's going on for us. So it's a lot harder to spot when someone is in crisis. And I wanted to forward you to a really great resource written by leaders in this area, and you'll be able to download that from these notes. And they kind of have put forward, what are the best red warning flags we have at the minute if we want to identify people in crisis state. And the really most key one that I want to emphasize is change from your normal state. This is really, really important. If you think back to what I was saying about how mental illness and autism, sometimes it's not quite easy to see what's what. So say you're someone who always needs time to decompress after social events. In neurotypical people, social withdrawal could be seen as a sign of being suicidal. In autistic people, social withdrawal is really, really important. Similarly, if you are looking at a non-autistic person, you might be looking out for crying. Autistic people may not cry, they may. A lot of the signs are less clear. So what you really need to look out for are changes in the person's state. So are they withdrawing more than usual? Are they finding less pleasure in things? Even if they always have quite flat emotional, like if they don't show much emotion in their voice or their face, have things changed? So I've mentioned this about how some autistic people will verbalize suicidal behavior, or suicidal thoughts, but many won't. Masking is a really automatic behavior for a lot of us. It becomes quite automatic. It's a learned behavior that we use to protect ourselves. And very often when we go to professionals, we're still wearing the mask. We're not breaking down because it's not safe to. And so people might say they're fine, or they might, appear fine, even when they're telling you that they're in crisis. Whereas you'll find some other people really can't express how they feel. If you think about alexithymia, they might really struggle to pin that down. That's why we have to be really vigilant and actually listen really carefully and watch. And listen, I really want to emphasize, because many autistic people find they're not listened to. When they say they're in crisis verbally, often people don't pick up on that. So I've mentioned withdrawal as something that's really important for people to stay well. Autistic people really need alone time. They need hobby time to stay well. So withdrawal in non-autistic people might be a sign of in crisis, but in autistic people it's really important. So what you're looking at here is increased withdrawal. So does someone need more time to recover or regulate after social encounters? Or maybe they can't regulate. So their normal might be that they need some time, they need to withdraw, but maybe when they're in a crisis state, they start to need more time. It takes them longer to recover. Maybe they can't recover to the same place they were before. I mentioned this one about loss of interest and pleasure in typical things they love and enjoy. This is a key sign of depression, as I mentioned, this thing called anhedonia. And it's really significant for autistic people because our passions are such an important part of us and they're such an important part of our well-being. So when someone starts to show less interest in those passions, that's really, really important. Traumatic events. So has there been anything lately that has caused your loved one a huge deal of stress or trauma? Really, really importantly, what's traumatic for autistic people is very different to what is traumatic for non-autistic people. So losing something or someone you loved, moving house, losing something, an object or a possession, a difficult social encounter. Many things that other people would just sort of sail by are really impactful for us. And so trauma kind of can come from many different areas. What you will often see, and again it marks that kind of change in functioning, is that when autistic people are in a bad place with their mental health or in crisis, they kind of regress. So you lose communication skills, your ability to read other people gets worse, your mental flexibility gets worse. And that's really problematic if you think of suicide risk, because a person at high suicide risk often doesn't see any way out. They are trapped in a kind of thought loop where the only way out is that way. So when you're in crisis, your worldview kind of narrows. It's that cognitive rigidity that I mentioned, and it makes you at much higher risk because you can't see any other way out. So this is really important because you might know someone as generally a pretty good communicator. Generally, they're quite aware of how they feel, but when they're in crisis, they might have more sensory sensitivities, they might lose the ability to communicate, they might have much more difficulty with cognitive flexibility and understanding other people. So it means that they struggle much more to regulate themselves. They might be much more dysregulated in terms of their emotions. So you might also see in someone who is really struggling with their mental health or with suicidal thoughts, increased self-harm or more severe self-harm. So it might be that self-harm is something they use to regulate their emotions. Quite often what you'll see when people struggle to regulate their emotions is they will engage in there are many mental health conditions or problems that sort of tap into that same function of regulating your emotions. So self-harm, eating disorders, substance use, these are all things that all ways that people try to regulate their emotions. And so you might see an uptick in these kinds of behaviors that are used to regulate emotions. Now, the next ones in this guide are kind of especially indicative of suicidal thoughts. So having increased anxiety and depression, more than the usual level, because let's face it, a lot of us live with a fairly steady baseline or normal of these things. So it's when it seems to be even more than greater, with all the symptoms that go along with that. You might also see that people have a new focus on suicide or on death that is not part of an existing interest. And that can be quite hard to identify. This resource is fantastic because it actually gives you several little scenarios, little case stories, which show you how to differentiate between an interest that's part of a sort of general interest and a personal interest or intention. And another really important sign is when people seem to be seeking means for suicide, or making plans, or even rehearsing suicide plans. So, for instance, giving away beloved possessions or pets, or making plans for them. One thing I want to emphasize here is that often when people have made a decision to end their own lives, they might actually feel better. That might sound counterintuitive, but being in that state of having suicidal thoughts is very difficult. And considering whether to act on those thoughts is likewise very difficult, very stressful. When someone has made that decision, some people say it's like a weight is lifted, the decision is made, the die is cast, so they might actually seem happier, they might seem more free. So you might on the outside think, oh great, they've turned a corner. So you need to just be really aware of this. And you might also see people talk about having no reason for living or no sense of purpose in life, no future. You might see people talk about hopelessness or being a burden. Sometimes it's really hard to kind of unpick what these statements mean, because for many autistic people, feeling like they have no sense or purpose, or feeling, isolated from others is a daily reality. And so they might be stating these things in quite an objective, matter-of-fact way. So again, the resource gives you kind of some clues around how you can identify the sort of intent behind these words. But what we do see is that burdensomeness in particular. So saying that everyone will be better off without me, for instance, or I'm not worth anything and I make things worse for other people. Those are really, really important warning signs for suicidality. So you've got to be a little bit thoughtful with some of these statements, because they're very indicative of someone who's struggling, but some of them may or may not actually reflect someone who's at risk of suicide. But the burdensomeness one I really want to emphasize there. So the key point I wanted to mention, again, was that point around change. It's really knowing someone, what is their normal, that you can notice signs of change. And that really says a lot about the kind of healthcare we need and the kind of social care we need, don't we? We need people who know our normal. So I've got about 10 minutes left, I think, and I want to just finish with a few words about supporting autistic people and making a better world where we have better well-being. So if we think about that list of factors I talked about earlier on, some of them we can't do much about. Our genetics, we can't do much about it, any of us here today. But there's a lot we can do about our environment. So I mentioned the environment is a huge, huge factor in autistic people's mental health. I talked about how often they are victimized or excluded or made to fit into environments that are so invalidating and, inaccessible. And so I want to share with you something I learned the other week. I attended an autism conference, and one of the most interesting things I heard there was that to a high degree, mental illness in autistic people is explained by trauma. In scientific terms, we say the relationship between depression and autism seems to be mediated by trauma. What that means is trauma explains that relationship. So when I first heard this, I thought, wow, I was sort of staggered, and I thought, this is so sad. But at the same time, I also thought it was, I hope you'll understand what I mean when I say I also felt it was slightly positive. Because in my years of researching on this topic, I remember reading papers that were written in the 70s and 80s. And people talked about autism and mental illness like it was, just an inherent part of being autistic. And very often the studies were, talking about people in really dehumanizing ways and saying, oh, this seems to be a natural progression of the autism, this depression. It's got nothing to do with the fact that, this person is isolated and treated badly. Nothing to do with this. It's the autism. Whereas this finding really tells us that we don't need to have bad mental health. We don't need to have high suicide rates. They are not inherent aspects of our autism. And this links back to the genetics that I mentioned earlier. Some studies show that the genetic kind of factors that lead someone to be autistic actually seem to increase risk of mental illness because they're associated with having more trauma and more negative events in your life. So again, it's not the autism, it's the environment. So to a degree, there's a lot of things that are beyond our individual control. We might have people that we support, but to a large degree, this is where we really need charities and organisations to really advocate for us. We have a broken system, I hate to say that, but our education system does not work for neurodivergent people, or ADHD, autistic, ADHD, doesn't work for us. Our health system doesn't work for us. Our social care system doesn't work for us. Criminal justice system doesn't work for us. So while this is the case, we are not going to have better mental health. We really need to kind of take it away from an individual level. Some autistic people have said to me, actually feeling suicidal is a completely rational response to the life I lead and the lack of opportunities I have. So we actually need to kind of move away from framing mental illness as, wow, there's something wrong with you, and saying, look at this environment, we need to change this environment. That being said, there are things we can do to kind of, while that change is very slow to come, that systemic change, there are things we can do at an individual level to help us be more resilient. So I've mentioned difficulties with emotions a lot of times. So difficulties identifying and regulating your emotions, they really leave you open to lots of different ways that mental illness can kind of bubble up. Might be in the form of eating disorders, might be through self-harm, it might be substance use and so forth. So treating or kind of helping people with their emotions is really important. Another thing is helping people with what we call psychological or cognitive flexibility. So if you think about cognitive rigidity, flexibility is sort of being able to adapt, being able to have a worldview where if this thing happens, it doesn't mean the whole thing is completely destroyed or wrecked. I can adapt to this thing. I can sort of manage my emotions and my thoughts. So there are different therapeutic approaches which kind of work on these things. So there are interventions that help people kind of work on psychological flexibility and emotion awareness and regulation. So they're kind of third wave, what we call third wave psychological interventions, and they kind of work on how you relate to your thoughts and emotions. So things like acceptance and commitment therapy helps you identify, what's important to you in your life and sort of work towards that. Dialectical behavior therapy, which was developed for people who really struggle with emotions, who really struggle with self-harm and suicide. And what all three of these approaches have in common is that they're very skills-based. They are giving people a toolkit to help regulate themselves and help cope with life ahead, rather than just treating mental illness. Compassion-focused therapy. A lot of us are very self-critical. So some autistic people say that, self-compassion was such a massive thing for me to learn. There's also, I've mentioned, social withdrawal. Might seem unhealthy for non-autistic people, so healthy for us. Passions. So I actually kind of hate the phrase special interests. It's really pathologizing. It's like, Let's just talk about passions and interests, and those are so important to our well-being. So autistic people talk about entering into a kind of flow state. When they're deep in the rabbit hole, they're really in there with their special interests, they're really lost to time. And research is showing that, researchers have always thought of special interests as a sort of pathological thing, but actually it's so important for us. So we need to make space for that. I'm guilty of not making space for that. And if you think about these ones, masking, feeling like you don't belong, feeling like a burden, these are again really tricky ones that require a lot of systemic change, because we need environments which are safe for us to unmask in. But I think what people can do to help sort of at least develop some resilience to the environment we all live in, which often does force us to mask, is connect with other autistic people. I think a really fundamental lesson I've learned is that autistic people need other autistic people. That's something that research participants have said to me so many times. So connecting with your tribe, whether that's online or in person, people who have similar kinds of experiences where you're not, the odd one out. And research is showing how important it is for autistic young people to have a positive autistic identity. Basically, to see autism as a difference, not a deficit or a disorder. It's something that makes me really good at certain things. I'm weaker in some areas, but so is everyone. That has always gotten forgotten about in kind of popular narrative. It's always been seen as autism, autistic people having all these weaknesses, but there's never been any balanced recognition that everyone has weaknesses, and autistic people also have a ton of strengths. So we really need to help autistic young people develop that sense of positive autistic identity. And joining autistic communities seems to be really important for that. I'm going to finish very quickly. But I want to just say lastly a few words about supporting someone who is actually in crisis. I think key thing I want to say is about knowing the person as the expert in themselves. So I think very often people miss the signs, miss what people say, or misinterpret them, maybe don't fully listen. And so what your job is as someone, if you're someone who supports autistic person, is to really listen, to make the space and make it as easy as possible for them to communicate what's happening for them. So remember what I was saying about regression. When you are in a really bad place mental health-wise or in crisis, your mental resources are a lot lower. You've got maybe more sensory stuff going on, you're more emotionally dysregulated, you might understand language to a simpler level. So make it as easy as possible. Be calm, be logical. If you think of people as an emotional sponge, make sure you're not kind of emitting all your own emotional energy there. And really importantly, be clear. Be explicit in your communication. People are often scared to talk about suicide. They're scared to ask about it because they wonder if talking about it might actually give the person more thoughts. We know that this isn't true. Talking about suicide doesn't increase someone's risk. Actually, if someone is suicidal, they're alone with those thoughts. Those thoughts are going round and round in their head, and they are alone with them in many cases. And so talking about them means that they are no longer alone with them. So you're not giving them thoughts they hadn't already had. You are just giving them a space to share those thoughts so that they're not alone with them. But talk about them in a clear way. Don't pussyfoot around, with the kind of euphemisms. Please don't say you're not thinking of doing something silly, are you? Because that kind of stigmatizes, if you think of what I was saying about suicidal thoughts sometimes being a very rational thing for that person. So just be direct. And the guide that I mentioned will also give you some examples of how you can do that. Remember, they might really not know how they feel if you ask them. So maybe think about asking them about their emotions or trying to gauge their emotions in a different way. I think it can be really helpful to ask people what happened rather than how they felt. So, for instance, if you asked me what happened after I had that difficult meeting at work, I might tell you, oh, I went home, I was so exhausted, I slept the whole day, or I might tell you I self-harmed. And those things will tell you that thing affected me, because I might also say, oh, I went off and I did my thing and I was fine. So you can get a lot of clues about my emotional state from how I reacted to things rather than asking me about my emotions directly. Give people more time to respond, remembering that kind of extra load on them when they're in crisis. Reduce demands as much as possible. And this is a really important thing, certainly in burnout. So try and get them away from the things that are causing them huge stress. You might want to lean on their passions to try and sort of draw them out of their thoughts. Consider the environment, if that's safe. Connect them with professional support, but really importantly, be with them, because we know that professional support in this country is a minefield right now. So it's not an easy solution. But I want to mention an evidence-based intervention which is kind of coming out now as helpful for autistic people, and that's safety planning. It's basically making a plan when someone is in a good place. What are the signs that might indicate that they're heading into crisis? What are those first signs that might indicate, okay, something's brewing here, I've stopped doing this, or I'm feeling more like this? What are the sort of orange flag signs? Okay, this is something I need to nip in the bud before it goes any further. What are the red flag signs? And what do I do at each of those stages? Who do I talk to? Are there things I can do myself? Are there things I need someone else to do? So very often a safety plan is something you can fill in with someone else. And then it gives both of you a roadmap. Because if you think about that reduced mental capacity when you're in crisis, you can't think, oh, who should I go to? Oh. If you have it all written down there, you don't need to think so much. So there's a link to that. And there's also a link to a really good resource about reasons for living, because people might find that quite challenging as well. So I'm going to stop here, but I would be really delighted to take any questions. Thank you so much for listening.